Greetings to you, Crocodile Army. I hope you're feeling healthy today because it's hard to get the rest of life's day-to-day goals done, much less longer-term ones, when you're not healthy. I don't believe I've ever lacked health coverage at any point in my life, and I've been fortunate to be quite healthy. If you're an American, it's extremely important that you stay as healthy as you have the power to be, and don't let your healthcare coverage lapse for even a second, or you may find yourself with an enormous, unexpected bill that could take a lifetime to pay. Most Western nations have decided that it's in the best interest of their society and their citizens for everyone to have universal access to healthcare beyond just emergency care, but we're nowhere near that yet. The Affordable Care Act, or Obamacare as many know it, was a small step toward it, but there's still a long way to go to bring us up to par with most of the developed world. I remain hopeful about it, but we'll see. Is America really the leader of the free world or the stubborn laggard? The battle cry on the right to keep the status quo for healthcare has a couple main arguments. One is that the quality of healthcare will go down for everyone because then poor people would get healthcare, perish the thought, and make everyone wait longer for service. Despite the misinformation that is spread about the Canadian, British, and various other European healthcare systems, the fact is the outcomes are better, so clearly they're doing something right. The other argument is that it's too expensive and we just don't have the money to pay for it. Of course, we always find money to pay for wars and corporate tax breaks or just about anything else that tends to benefit those with more money. The main issue is that anything that tilts the playing field less heavily toward the wealthy is going to be fought tooth and nail by them, and the rest is just finding a palatable excuse that doesn't just sound like greed. Just the decoupling of health insurance from employment would be great for society. It's all well and good to say, get a job that has insurance, but when there aren't nearly enough jobs in the US that have health coverage for the working population, then that advice can't help everyone. And actually, I think there are reasons for Ayn Rand types to like universal coverage. The people who see no excuses for failure beyond someone's own laziness should welcome removing lack of health insurance and the resulting medical bills as an obstacle. It would make it easier for them to make judgments about the so-called takers and who they really are. Illness is one of the main reasons why people file for bankruptcy. Someone has insurance through work, gets a severe or chronic illness that forces them out of their job, and then they have no way to afford insurance, which drags families from the middle class into poverty all the time. I'm sure some of you watching this right now have gone through that same sad cycle. America certainly has some admirable traits. However, I've been to dozens of countries, and I've never encountered a population that cared less about their countrymen than Americans. Even in third world countries or countries in the Middle East, where many Americans feel that they don't share our supposedly awesome values, there's a spirit of protecting your own that extends at least to their own countrymen. For many Americans, it seems to extend not really past their front doors, much less the rest of the country. I believe it's one of our ugliest traits as a people. Humanity dodged a bullet when Stephen Hawking was born in the UK. It's embarrassing to read about cases like the Canadian family who was on vacation in Hawaii when the mother gave birth very prematurely. They were stuck with a hospital bill for about $1 million. Some of the other details of the case make it even more embarrassing for our so-called health insurance system, which I linked in the info bar. Some things are improving because of the ACA though. Before the ACA, if you had a pre-existing condition, you could be denied insurance. In a practice called rescission, you could also be dropped from your insurance at any time for no reason at all, and some of the more expensive people who were insured were routinely and legally dropped just when they most needed their insurance. Car insurance companies could never do that, but healthcare insurance companies could. I'm sure I'm not the only one who cringes when I hear the analogy of, well, they're not going to insure your house if it's burning. I don't pay my local firefighters directly either, but I know they'll save my life if they can, because I'm a human being. Republicans have been trying to repeal the ACA for years. They claim they just want to replace it with something better. Still waiting for details on that proposal, though. Do you think we should trust them?